Assalamualaikum and hi. We are from Group 8. We will present about the article titled Assessing the Impact of Skin Cancer Awareness Now, SCAN, Intervention several months following the intervention. Before that, let me introduce my team members that consist of 4 members. Edna Natasha, me, myself, I'm Humaira, Tengku Ilya, and Ahmad Daniel. This is our overview. First, we have introduction, methods, result and data, discussion and conclusion. Next, I would pass to Ahmad Daniel for introduction.
First, I would like to make some acknowledgement to the people who created the article we are reviewing. The title of the article we are reviewing is Assessing the Impact of the Skin Cancer Awareness Now SCAN Intervention several months after the intervention. Its authors are Trupti Dumal, Virginia G. Scott, Roxanne Powers, and Kimberly M. Kelly. The publication date of the article is 16th of September 2023 in the Journal of American Pharmacists Association. The central question of this study is how effective was the Skin Cancer Awareness Now or SCAN campaign in educating a rural population with limited healthcare access. The purpose of this study was to evaluate the impact of the Skin Cancer Awareness Now or SCAN pharmacy-based sun safety intervention and follow-up. The results from this finding will determine whether the SCAN model is applicable for teaching skin cancer awareness in other parts of the world. For some background on the research done, West Virginia is a rural state in the United States with a high incidence of skin cancer. Intervention offers are often impeded by structural barriers, low health literacy, and lack of healthcare access. This is because West Virginia is a relatively poor state in the US, and they are often beset by problems with budget and also general literacy as well as poor standards of education. However, it is found that community pharmacies are highly accessible in the state and could be useful in promoting skin cancer and prevention. Thus, a study was done to evaluate the impact of Skin Cancer Awareness Now or SCAN pharmacy-based sun safety intervention and follow-up. This initiative was basically done to test whether or not this particular way of awareness campaign will be useful inside a rural population. Skin cancer is one of the most common cancer in the United States. The majority of the population in West Virginia is white, which is associated with increased risk of skin cancer due to low melanin. Individuals in rural areas are more likely to be exposed to high UV radiation due to doing more outdoor activities, such as farming, which fits the profile of most rural West Virginians. This will increase their risk of getting skin cancer. Thus, SCAN or Skin Cancer Awareness Now intervention is a community pharmacy-based skin cancer counseling approach that addresses the critical need to advise individuals of their skin cancer risk by providing personalized information and identifying strategies for management of high risk their risk in rural areas. The most cost-effective way of cancer control is prevention, which in the case of skin cancer means reducing exposure to risk factors such as UV rays. However, most people, especially in rural areas like West Virginia and other parts of the world, have less knowledge about skin cancer and its prevention methods. Thus, SCAN is one of the initiatives meant to improve public awareness of skin cancer and to prevent it, especially in rural communities, through community pharmacies.
Moving on to method, the method is divided into 4 parts, which is participants, procedures, measures, and analysis. The participants involved in the Skin Cancer Awareness Now SCAN consist of people who are 18 years and older and are able to write and read in English. Other than that, individuals who are present at the community pharmacy counter for their prescription or other service such as counseling. Next, individuals who are recruited by the student pharmacies, and the fourth one is affiliated pharmacies in participating pharmacies in West Virginia. And lastly, the original scan participants, which is 90 people, were contacted. Participants will complete a pre-intervention survey that they will answer approximately 10 minutes given. After the survey, participants will be given recommendation on steps to prevent skin cancer by an in-person counseling. The follow-up data was collected by contacting participants telephonically. For the measure, the follow-up survey was identical to the pre-intervention survey, except the questions were not repeated and have an additional question. The survey question consists of affect, cancer worry, cognition, knowledge, and perceived importance, and behavior, which is intention. Affect was measured using 2 cancer worry items. Knowledge assessed with 2 items, which are the amount of sunscreen used and the features of melanoma. While for the perceived importance, it was assessed with 6 sun safety items and key skin prevention behavior. For the intentions, it was assessed with 6 key skin cancer prevention intention. For the analysis, mean was computed for each of the pre-intervention and the follow-up assessment. And all of the quantitative data analysis procedure were conducted and analyzed using SPSS Statistic 28.
Okay, let's move on to the data of this article. For the participants' background, results shows a total of 56 individuals participated in the follow-up survey of the skin cancer awareness interventions. The participants' mean age was 44.7 years. 87.5%, which is most of the participants, were females, and 92.9% were white peoples. 48.2%, which is nearly half of them, living in rural areas, while 37.5% of them have education college. 46.4%, which is nearly half of the respondents, reported a family history of malignancy, and 30.4% of them were employed full-time. Based on the result also, there was 50.3% of the respondents reported visiting a pharmacy at least once per month. So next, follow-up observations. These articles made observation on both previous feasibility study and during or after the follow-ups, based on the changes in worry, intentions, importance, and assumed knowledge. Okay, next, knowledge of the participants during the follow-up. The result shows 70% of them correctly reported knowing the use of the proper amount of sunscreen, and 69.2% correctly knew the 5 features of melanoma on aspects of asymmetry, border, color, diameter, and also evolving. Next, before and during the follow-up, based on the repeated analysis of variance for skin cancer screening intentions, there are positive increase in mean for 6 sun safety behaviors differ significantly from pre-interventions to follow-up. So there are similar trend increase in skin cancer knowledge, while mean worry remained low and the changes was not significant across the 2 points. For the perceived importance, there are improvement in mean and show a trend from pre-intervention to follow-up. Next, communications about skin cancer after skin cancer awareness interventions. In about 19.7% of the participants discussed the interventions with others, including family members, pharmacists, and dermatologists, while 21.4% were planning on talking to their family in the future. And 41.1% of the participants intend to talk to their pharmacists or pharmacy students. That's all for results. Next, I pass to Humaira.
Moving on to the discussion. First, when survey after almost 8 months up to 1 year, participants show improvement in knowledge and in the intention of staying sun safe. An improvement in participant knowledge may help expand sun safety awareness. Second, individuals may be more likely to seek early medical attention if they notice any changes in their skin. By improving their knowledge and understanding of the signs and symptoms of skin cancer, this can lead to early diagnosis and treatment, better outcomes, and lower mortality rates. Third, participants intended to communicate with their pharmacists or student pharmacists and family members about skin cancer prevention in the future. Patients clearly value their community pharmacist advice and see them as a key source of information regarding skin cancer prevention. Lastly, pharmacists and student pharmacists were crucial during intervention inflammation. Scan intervention provided give pharmacists the opportunity to improve patient care at the participating locations.
Overall, the finding from this study indicates that the scan intervention increased public awareness about skin cancer. The participants' intention to stay sun-safe had increased and they wish to maintain it. General knowledge about the importance of staying in sun-safe has also improved. And it is also observed that many participants also want to have further discussions with their pharmacists on skin cancer prevention in the future. Thus, it is concluded that the SCAN campaign is a success in rural West Virginia. It is hoped that the finding of this study can be used for awareness campaigns about other types of cancer as well in Malaysia. This increased public knowledge about cancer is especially useful in the rural areas, which comprises many parts of Malaysia.
That's all from